Welcome to Big Blend Radio's California Employment Law Podcast featuring San Diego attorney Ward Heinrichs. Welcome, everyone. So, we are still talking about the mid-year changes in regards to California's new minimum wage laws. So this is part two. We talked about this last month with Ward. And he said, you know what, when it comes to healthcare, this needs to have its own show. And you can read Ward's article outlining some of these changes, but this is so in-depth and complex that I'm going to say if you have any questions, you should probably call a lawyer at this point, because this is in-depth, it's huge, and I kind of feel like these changes are kind of a follow-up post-COVID of what's going on. And then at the same time, the minimum wage hikes that have been going across California, across the country in some places, but definitely California. So Ward, this is a biggie, huh? How are you doing?
Doing really well. Thanks for asking. How are you guys doing?
Well, we're doing good. We're in stormy Kansas City, and there's a lot of rain here. So I wish I could send it to our desert friends, but apparently it likes to have storms in the Midwest. So that keeps us on our toes a little bit. And you know about those storms, you know.
Grew up in Indiana, I know.
Sunshine in San Diego?
We did have some marine layer for a while, and it's breaking up right now. Pretty cool day, actually, like in the low 70s kind of thing.
Nice. Well, that's nice.
Nice.
That's pretty. Well, it's always nice in San Diego. I think you have like a 98% perfect day rate or something crazy.
Yeah. I don't mean to brag.
For 90%, he got smart. Ward finishes military and then goes, well, San Diego's pretty much the best. I think I'll set up shop there. And as a lawyer, did you know, like, California was going through so many changes in law? Like, is it just amped up over the last 20 years, do you think? Because these laws, there's always a change.
It's amped up. I think that's a great way to describe it. We have the Private Attorney General Act, which started in 2004, and Governor Schwarzenegger signed that in, and that allowed individual employees to step in the shoes of the state and enforce regulations that probably weren't enforced very widely because the agencies that enforce it only had so many people. And so that's really causing problems for employers, even now, even though they changed the law recently. And then, of course, minimum wage. We'll be talking about that. That has really ratcheted up. First time we spoke about it, I'm going to guess, was like 2016. And I remember declaring the year of the minimum wage. No, it's the decade of minimum wage.
It's over a decade. Yeah, it is. Yeah. Wow, I know. We've been doing all this archiving and doing our new podcast website for Big Blend, and everyone, you're going to see it soon under bigblendmedia.com. Ward's got a new page, and I was looking at, your expert page with us, and then all the magazines you've been in for over a decade, I think now, Ward. Yeah, you've been in for over a decade. And I'm like, man. And I just kept seeing minimum wage. I'm like, and that and the independent contractor. Those are two things that I've seen at the forefront over the last decade in what we've covered together is that. Minimum wage,
major things,
independent contractors. And I'm like, really? We were still talking about that, and harassment, obviously discrimination, harassment. That's a nonstop issue. But yeah, so healthcare workers, let's get into that, because this is complex, because not only do you have California, but you also have San Diego decided to go, well, we want our own minimum wage thing, right? So there's that.
Yeah. For hospitality, you're talking about?
Well, for hospitals. Is it hospitals or am I getting it twirled around?
I think you are. I included the
hospitality minimum wage.
Yep.
Sorry. Yeah.
Hospitality. Yes.
So we're doing hospitals or healthcare workers and hospitality. And hospitality, that word tells you where it comes from. So San Diego did a new minimum wage, which I get, because can we do the hospitality one first? It's easier.
It's easier. Yeah, let's do it.
Okay. So this is for anybody working in restaurants and hotels and that kind of thing, right?
Yes.
Attractions.
And the Padres are on the other side of this too. They said, hey, this is going to really drive up ticket prices, and all the employers are dead set against it. City Council definitely has strong supporters for it. And they say, well, hospitality workers need to make at least this much in order just to live in San Diego, the city of San Diego. And so you've got two different sides competing over it. There was a sub-council group that passed it, and it sent it on to the full council, and the vote is slated for September. We don't have an exact date, but probably September, the vote on it. And we'll know at that point whether whether the hospitality workers in the city of San Diego will receive $25 an hour or not.
So it's a city, so it's not Julian or Alpine or Borrego. It's the city proper.
Yes, it's the city. But, the city inside the county, the city is really large. It's a big geographical portion of the county of San Diego.
Okay, so does that mean the business in San Diego, like where they work in San Diego City? So if the employee lives in Borrego and commutes, which, my God, if you did, right? If you commuted, it doesn't matter. It's where the business is located, no matter where you commute from.
And it's interesting you brought up commutes, because there are people who commute from Riverside into the city of San Diego to work. Yeah. So that's a big thing too. But yes, if they commute from the outside and work in the city of San Diego, assuming this passes, then they would get $25 an hour.
So let's get into healthcare workers, the minimum wage. For San Diego hospitality minimum wage, it would go up to $25 an hour. I just want to touch on that because I know I've touched on this before, but because of people doing Airbnbs, VRBOs, vacation rentals, all that kind of stuff, people have been buying second homes and using them that way. And then the pricing goes crazy in an area. And so there's a drama over that are the TOT funds, which I think you call them in San Diego, TOT. It's like the overnight bed tax. Does that, are Airbnbs paying all that? So doing that, going back into the community as the pricing goes up because the income changes. So then employees oftentimes cannot afford to live in these, vacation destinations. And so they cannot, and then they have to commute. So it's costing more. So if someone wants to live downtown San Diego, that's not, that cost effective. Yeah, it is
expensive.
Yeah. And so I get it. I see both sides of this, but there is an issue for workers. You want someone to come and do the cleaning of your Airbnb, but you expect them to drive in an hour and a half from, you see what I mean?
Oh, absolutely. And that's a big problem throughout California. San Jose and Silicon Valley have said, look, police officers, they can't afford to live in San Jose or other parts of Silicon Valley. And so you see it up and down the coast, that issue of, can your workers afford to live in the place that they work? And honestly, $25 an hour, it might help that, but boy, things are just really expensive in San Diego. So maybe it'll relieve it somewhat. In fact, one of the council members who supports the bill said there was a study done, and I forget who did the study, but a big organization, one that you might trust, said that you really need to make $33 an hour in order to live in San Diego. So it's expensive. And, having people who don't commute into work is very difficult to do here.
Now, are you seeing, I know we're going to get to the healthcare workers, but are you seeing any rumblings about changing how tips are handled? Because that's another thing that goes up and down in restaurants, is whether or not the restaurant's going to allow tipping, or it's like, hey, get rid of the minimum wage and live on tips only. It's kind of a weird thing, but some areas, restaurants are not allowing tipping anymore and just going, here's your salary kind of deal. Have you seen any changes coming, any kind of talk over that in San Diego?
No, California has some pretty strict laws about tipping, and a tip belongs to the server. Now, there are other rules that an employer can invoke. They can require tip sharing, excuse me. But they can't say, well, if you do get tipped, then you got to give it to me. And then the question would be, well, maybe, no one charges a tip around here. I mean, every once in a while you see a bill that does charge gratuity, but not very often. And it's up to you as a person if you want to tip or not. I don't think you could stop it. I don't see how you would.
It's normally if you have 8 to 10 or more people in a group, it's automatically added in there, I think.
Yeah, if you have a party of going somewhere. But I've even had fairly large parties where they didn't do it. Probably under 10, I'm thinking about, but they didn't put a gratuity. I'm thinking the last time I took some cousins from out of town out with my kids, And so we had 8 people, and I wasn't charged gratuity, but I tipped, of course. So yeah, getting rid of tipping, I don't see that happening in California, but I suppose it could, because you don't have to tip. It's not required. And so I suppose if the owner said, we don't accept tips here, then people go, okay, I won't tip them.
Well, yeah, because there's a brewery, a New Belgium brewery in Asheville, North Carolina. You go to do a tip. The tips don't go to the employees. The tips go to a charity. That's what they do with your
Yeah, you
tips.
can't do that in California. If there is a tip, it belongs to the workers, not the house or anyone else.
Okay. Well, we're not in North Carolina, so let's get to the healthcare workers because this stuff is complex. We were just easing into this, y'all, because
Yeah, no, here's the hard stuff. It's
okay,
a
you go
dense
for it.
legislation.
Go, Ward.
Yeah, it's a dense legislation. I really didn't realize how dense because no one's come up with a question about it, and I haven't looked at it that much. I kind of knew where it was in the code section, and I'd seen a bit of it here and there on the internet. And so then when I opened it up, I'm going, oh my gosh, this is a ton of pages for one piece of legislation. It has so many different kinds of definitions, and those definitions may exclude this one group, but maybe that group's back in later because there's another chain there. There's another definition of. So several definitions may compete or refine each other in order to really know. All right, so there are some, if you have a big hospital or an integrated medical group that has 10,000 or more, well, that's pretty much automatic. That's not a hard one. But when you get below that, then it can really be complicated. And there's other ones that are simple, like dialysis, that automatically qualifies. There's no exemption for them in any way. Those are the easier ones, but then there are, if some guy came to me and said, hey, I'm working for a healthcare provider and I'm working over here in the country. And then all of a sudden you say country and you go, oh no, there's all sorts of different regulations for that and definitions for that type of worker. And then, so you'd really have to wade deeply into the legislation to try to figure out whether that person may or may not qualify for the new minimum wage.
So this is about $25 again, right? This $25 kind of thing. And who gets it and the size of the facility. So it could be an urgent care, it could be a clinic, right? And then it goes from there. And this is all of California.
But not all clinics and not all urgent cares. That's the thing. You're right. Generally, yes, they would be in it, but there's ways to be excluded. And it is 25. It actually, a better way to define it or to describe it is, it starts out less than 25. And so unless you're one of these special things, you start out at $23 an hour and it goes up to 25 by the end of 2027. But again, there's so many exceptions to that. I don't remember the group, so don't make me tell you which.
Yeah, everyone, this is so complex, like I said at the beginning, that you may want to just go get legal advice for your specific need, right, on this.
Yes.
When it comes down to it.
But where I was going was there's a group of healthcare providers who need to start out at like $18 an hour, and then over about a decade, it works up to $25 an hour. So it's not uniform. Complex. Like I said, there's some easy ones, but then if you're in one of those harder categories, it really takes some wading into the nitty gritty, and it's not easy to read. I mean, you want to fall asleep at night, read this code section.
Okay, so you mean we're not playing Boston Legal with cigars and scotch at the end of the day and reading through things like this? This is not like that.
Well,
not fun.
Yeah,
not fun
Oh, you could do that, and maybe scotch would make it easier. You could have a big thing of scotch and come home and go, I know, I want to read the new minimum wage healthcare law. And then after a bottle of scotch is gone, you will be very confused.
And you won't remember anything, and there will be a lot of fine print that's a big smear. But here's the thing with this, when we think of when it's healthcare, and this is why I wonder if it is like a spillover from COVID where everybody's worried about what's going on, like who was in the line of fire during COVID of possibly getting it. So this is not healthcare workers only that can qualify, right? Because it's about who is working. So you may have a maintenance crew, that may also qualify because they're in the line of fire of whatever's going around the hospital. Or I don't know. I'm putting that in for myself.
There is a mention of COVID, but what it really was referring to was we saw that what the pressure of that kind of thing can put on the healthcare services. And we saw that maybe we don't have enough people working in healthcare services. And that was the big thing. We want to be able to keep people interested in working for healthcare by giving them incentive. That was really the essence of this. But it did mention COVID. You're right. It did mention it.
I think it came from that. That was like, oh, we don't have enough people. We don't have enough teachers now either. We don't have enough medical people.
Don't
What
get me
about
started on
grocery
teachers.
stores? Grocery stores, anyway, don't.
Real quickly on teachers. In
Uh-oh.
San Diego County, the student population has dropped by like 20,000 in the last 4 or 5 years. And they think that trend's going to continue. So they're talking about closing schools. So anyway, so do we have enough teachers? I think we probably do, because we're going to have fewer schools.
Where are the kids going? Or is it just people moving from California or homeschooling instead?
Well, I didn't read the specific reasons, but I can guess a few. One would be people moving out, but the bigger one is going to homeschool and going to schools that are outside the regular public school system. Oh gosh, what's the word I'm thinking of? The charter schools. That's the word.
Oh, yeah. Okay.
And so those are generally outside the school system. There is a connection, but anyway, so you see more of those alternatives being used. And then I think you're right. Part of it is people are leaving. It's expensive.
They're going to Texas.
My neighbor across the way, his family, except for him, has moved to Texas, and he's getting ready he doesn't know if he's going to sell his house or rent it. And then when he figures it out, he's going to. Texas
and Arizona. And then, it's just, what are we going to do? The American shuffle. We're just going to keep shuffling around. And the thing is, too, we don't have to be in cities as often and as much, because of remote work. So things are changing. But for healthcare, there is no replacement. There is not like, okay, I'm going to doctor. Well, there's some, telehealth and everything.
There is telehealth. I was going to say
there
that.
Is that.
That's more common now.
But still. You're still working, and it's on call. So, anything in healthcare it's at the top of the list of taking care of things, because that's, life and death and comfort, and hopefully no one's in pain, that kind of thing. So the minimum wage hike started in October of 2024. So we're still kind of new. We haven't gone a full year yet.
It's pretty new.
So people are still figuring out. So this will affect just even doctors' offices. I don't know. Doctors are just, here's my own office. They have to share.
I know that if there's a physician group of 25 or more, then yes, it is affected by this. If it's a group of fewer than 25, then no, they don't qualify. Now, again, it's complicated. There may be other reasons why they might qualify. If they're part of a hospital group, associated with a big hospital, then they may qualify. But that's, again, the fine print. And I can't even say that they might qualify. It really depends on the specifics.
Are you talking about the employees qualify?
Oh, no, it's not so much the employees, because essentially, and you touched on it earlier, if you're doing healthcare service or support service, so janitors, if they're working it's who you work for that's really qualifies you or not. And almost everyone, now there are some exceptions, but almost everyone who works for that hospital or is an independent contractor working for that hospital will get the minimum wage. So again, maintenance, yes. Janitors, yes. So they're all covered. So the real question is, who do you work for? If you work for one of these covered businesses, then you will get the minimum wage.
But you said independent contractors. How can an independent contractor get a minimum wage?
Because the law requires it.
Okay, but doesn't that go against itself?
Well, no. All right. I see what you're saying. So if you work for a contractor who has a contract with this big hospital who has 15,000 employees, then the employees of the contractor must get paid that minimum wage.
But if you're an independent contractor and say you go in, it's just like the band used to play in the bar. And if it went to the bar 3 times a week, you're kind of an employee.
Yeah, then, now we're getting off into AB5. And yes, there could be, it's possible you might be designated as an employee, but it is only for employees. And when I used the word contractor, I meant like a janitorial service that has a contract with the hospital.
Okay. So then you have to look at your business dealings. Like if you go in and you're the baker for all the, hospitals in San Diego County and go, here's the hospital loaf of bread.
Yeah.
I don't know if that exists, but So that's going to change because, wow.
As long as that baker is providing a service that supports the health industry. If it's just, I don't know, because there is a provision that I read earlier this morning that talked about businesses like a baker who is really only providing services for not for the patients, but maybe for the C-suite. They come in and say, C-suite, here's your big C-suite cake for the week. They may not be covered. That's why this law is nuts. I mean, really, it's nuts. And you have to ask all those questions, and you have to read this dense thing if you get into the weeds on one of those weird situations, it might apply, it might not.
Wow. So each thing is individual. But like in usual, like if it's a nurse, okay, let's do nurses, right?
Okay.
So nurses in a hospital that has over 25 employees, you are getting the minimum wage, or do you get more than that? Because you're a nurse. Shouldn't you get?
Not over 25 employees. You're confusing the number 25 for a medical group of doctors. It's got to be, if you're clearly working for a hospital that has more than 10,000 employees.
Oh, that's okay.
Yeah, then yes, minimum wage. But that goes for janitors and anyone else too. Yep.
Okay. So
now, I think most nurses make more than that anyway. I mean, I didn't look.
Yeah, that's what I was saying. You've got to be doing more, and minimum wage is a little different. But so, yeah, if you're going and cleaning the rooms, janitors, those kind of people, then that's going to be, the engineers, that's going to be what's going on there. Okay. So,
but if you work for a doctor's group that has 25 or more employees, you get it too. So those nurses, if you have janitors, whatever, they're getting $25. So
dentists included, all those, plastic
that's a good question. I don't think this includes dentists, but I'm not.
So this isn't all healthcare then. This is more like, because that is healthcare. What about eye people and foot people and?
Well, yeah, no, doctors certainly would be. So if you're talking about ophthalmologists, for instance, yeah, they could be a part of this. Again, if they're in a group of 25 or more, sure, they would.
Okay. The real question is chiropractors.
Oh, that is a good question. That's another one I'm not positive about. All right, here, let me just count the number of pages this has for you, just out loud. So the first page is like maybe a third. Then we go 1 full, 2 full, 3 full, 4, 5, 6, 7, 8, 9, plus the other, one that was a third. That makes like 9 full pages. And that's like a big legislation. But then it's the way it's written too. It's just so nitpicky, intricate, and dense. Really.
This is not a little bottle of, this isn't a dinky airplane scotch.
It's not simple. Bottle. It's not simple. Like I said, some of the situations would be simple, but a lot of it just isn't.
So each hospital, for example, or medical facility, what about like rehabs and things like that? Now I'm thinking like all of those kind of therapy centers and mental health centers, and
definitely psychological services can be a part of this.
Wow. Okay. So each place needs to have legal counsel to make sure they're doing it appropriately.
Yes. Well, of course, if you're a big hospital, you're going to have legal counsel anyway, and they'll probably delve into the weeds on this legislation, and come up with a beautiful written brief to give to their clients, and then their clients will understand it and they'll explain it to them. So that's the easy one. Then there's all sorts, there's just going to be a lot that aren't that easy, and maybe you don't have counsel. It kind of depends. A small contractor who has a contract for lawn maintenance at a place, the building that houses 25 physicians who all work as a group, I think they're covered.
Whoa.
Or at least arguably covered.
Wow. So it is. So anybody who's in the industry, the employees should go and check it out too, basically.
Yeah.
Everybody needs to know to make sure that they're covered the way they should be. The employee. And so HR needs to be aware, and, all the book people, all the people that do the salary stuff. And
yep. Because it's all support services. And another way for people to kind of learn on their own would be with the Department of Industrial Relations, their California Department of Industrial Relations. They have a website that gets into it pretty well, describes a lot of this stuff pretty well.
Oh, okay. So that's something for people to know. So basically, Anybody that has anything to do with health in California, go be aware. And do you think it's going to change by January when we do your big update, your annual update of laws?
Oh, I doubt it. I mean, I don't think it's going
That's
away.
done.
And the steps, the progressive steps of increased minimum wage over time, I doubt that changes. I think it's there, and it's just going to be enforced as it progresses.
Wow. All right. So a lot changing all the time in California. Everyone, bestemploymentattorneysandiego.com. If you're unsure, call Ward. I still think we need a 1-800 call. I know you need those billboards. Call me. I'm aggressive. And, and he'll read the fine print for you. You see, I think that is, the most important thing is someone who can read the fine print, understand the fine print, and then put it into English. That's important. We need that. All of us need that. Otherwise, we'd have our head in the Scotch bottle, and then we'd have to go to the medical people who will have to do the minimum wage. There you go.
Yeah.
Man, so does this affect people in salaries? No, just only the wage people.
No, short salary. Yeah. Oh. Yes. So as the minimum wage, because the state minimum wage, as that increases, then the salary will increase as well. Okay. Yeah, I should have put that in my article, actually. That's a good point.
Okay. Well, we'll put it in the article. So there you go. Everyone, that link is in the episode notes. So again, you can go to bestemploymentattorneysandiego.com and contact Ward for questions there. I know you're really cool with talking to someone on the phone before they hire you to make sure it's all, cozy with people and that you can help. And sometimes, some things aren't employment law. Sometimes I found out, I always thought, oh, Ward could help on this. And he's like, that's criminal law, Lisa. I don't know why it's always criminal law whenever I bring something. Nancy's the worst at that. She likes the criminal stuff.
She does. She loves to spin out criminal law scenarios and have me answer. Yes. And then I will say, well, that's really criminal laws.
And it's Nancy. Yeah. Anyway, there you go.
I'll help as much as I can. In workers' comp, that's another one. You think, oh, you're an employment lawyer, you must do workers' comp. Not usually. I mean, most workers' comp attorneys call themselves workers' comp attorneys.
Yeah, those are the two things, workers' comp and but minimum wage is a big deal in California. And so I wonder what's going to happen in Washington State and New York with this too, because they're all kind of connected, unless it's already happened there in those states with this minimum wage for the medical world. This will be interesting because now it's basically going minimum wage according to type of work or institution, not even type of worker, So it really is starting to change.
There's a trend that way.
Yeah, if you're looking at the fast track, is that what it's called with the fast food workers? See, it's only fast food workers, only so many people, and So I think it's going to start getting by industry, which will be interesting because one day the landscapers will have a minimum wage, and then the landscapers are working at the hospital, and then that becomes a thing. Who wins over that? It is going to get weird.
Well, minimum wage hikes put pressure on all wages to be increased.
All right. Thanks so much, Ward. Thanks everyone for listening. As always, Ward's here every fourth Wednesday with new episodes. I wonder what he's going to talk about next month. Who knows? We might get into criminal law if we can get Nancy on there. She'll send you questions.
Hey, she can ask me a criminal law question. I'll do my best.
There you go. Thank you for listening to Big Blend Radio's California Employment Law Podcast with San Diego attorney Ward Heinrichs. Keep up with Ward at bestemploymentattorneysandiego.com or follow him on LinkedIn, Facebook, and Twitter. You can also subscribe to Big Blend Radio at bigblendradio.com.